Hello everyone, thank you for tuning in. I'm Dr. James Randolph, physical therapist, and in this video I'm talking about sciatica. This is by far one of the most common diagnoses people will present to the clinic with. But before we get into the rehabilitation aspect, let's first talk about what sciatica is. I have my spine model here, so I'm going to do a quick crash course on the anatomy of the spine. You ready? The first 7 vertebrae make up the cervical spine, the next 12 make up the thoracic spine, and the bottom 5 make up the lumbar spine. So when we talk about L1, L2, C3, C4, we're talking about what level of the spine we're looking at. In between the vertebrae are the intervertebral disc. They're like jelly donuts between the spine, which allows us to bend and move the spine all around. Our brain sits up here. Coming off of the brain, we have the spinal cord, which runs down the spine, and at each level in the spinal column, we have nerve extensions coming off of the spinal cord. These nerve extensions in the lumbar spine extend out, form the sciatic nerve, which runs all the way down the back of the leg. Now, when discs herniate, the majority of the time the discs herniate backwards, hitting the nerves behind it. The more a disc presses against the nerve, the further pain starts to refer down the leg. We call this peripheralization. Other times the pressure on a nerve may be from bone degeneration, arthritis, spinal stenosis. If pressure is taken off of the nerve, numbness and tingling can start coming out of the leg. Depending on what's putting pressure on a nerve, there can be general pain behavior patterns that are typically associated with these different underlying causes. For instance, people may say, sitting makes it worse, or I can't bend forward, or I have to lay on my right side with a pillow under my leg, it's the only way I can get comfortable. Or how about, if I sit too long, I have to stand up and walk around and it feels better, but if I keep walking around, it gets worse. These are all common pain behaviors for specific lesions of the spine. There's often positions, movements, stresses that make pain worse, and there are oftentimes positions, movements, stresses that make the pain better, or at least somewhat more manageable. One of the goals of physical therapy is to identify those movement patterns and overemphasize them in a very systematic way, and to avoid the recurring stresses that cause the pain, to set a clear path for recovery. Now, following an examination, a specific exercise program is then developed for each individual's unique situation. It's really important to know that there is no one-size-fits-all group of exercises for back pain. What helps one individual may be very harmful to another individual with the same or similar diagnoses, and unfortunately, we cannot solely rely on the findings on x-rays or MRIs to determine this. Do you have spinal stenosis? In which case, flexion exercises have been shown to be beneficial. Or is there disc herniation, in which case extension exercises of the spine have been shown to be beneficial? What if there is spinal stenosis and disc herniation? What do we do in this particular evaluation? Well, we do a mechanical assessment in order to determine the relevancy of these diagnoses, and then a customized exercise routine is developed. Now, with that said, these are some of my favorite exercises for the spine.
The following exercises may be prescribed by a physical therapist on an individual basis and only after a thorough mechanical evaluation has been completed. Some exercises may cause further pain or injury to an individual based on their unique circumstances. If you suffer from pain or disability, it is highly advisable that you do not attempt these exercises until you have been cleared by a licensed healthcare professional with expertise in musculoskeletal evaluation, such as a physical therapist.
Here we have a prone press-up, one of my favorite exercises for the back. A significant number of people may respond very well to extension of the spine, decrease or abolish symptoms of sciatica, and reduce baseline back pain. Now, there are also people who may do a lot more harm than good with this particular technique. Why does this work? Well, again, when discs herniate, the majority of the time they herniate backwards. As humans, we constantly bend forward, and when we bend forward, we put pressure on the front of the disc. Over time, the disc starts migrating backwards, puts pressure on the outer rings of the disc, which are innervated by nerves, and eventually hits these nerve roots behind them. The disc can also start herniating to one side or the other, and this may be why people tend to have pain down one leg or the other. Extension has been routinely shown to centralize symptoms of sciatica, bring it out of the leg. Now, there are several different progressions or modifications to this exercise that can be explored based on each individual's response, but again, this can be very effective in many cases. I have one more exercise I'll show you. Lunges, one of my favorite exercises. Many of my patients do lunges. A lot of people have difficulty with this at first. There's the old saying, lift with your legs, not your back. People throw their back out all the time with bending and lifting injuries. Nurses, warehouse workers, home caretakers, shoveling snow, gardening. So the saying goes, lift with your legs. But you have to have the mobility in the knees and strength in the legs to do that. If you can't bend your knees because they're stiff from arthritis or your legs are weak, you don't have much of a choice but to bend at the waist and use your back to reach something on the ground. So to help treat the spine, you have to have knee mobility and leg strength, and this is where this exercise comes into play. It works a lot of muscles, a lot of joints, works on balance, is a very functional exercise. It's also good to work on getting on and off the floor. Now be careful. For many individuals, starting this exercise may require supervision by a trained professional, but as it gets better, it can make a world of difference. These are just a few sample exercises and philosophies we use in physical therapy, which can be a very practical alternative to medications and surgeries for low back pain. Remember, you should consult with a physical therapist or your physician before initiating an exercise program for pain. Thank you for watching. If you enjoyed this video, click the link and subscribe to my YouTube channel for additional tips on physical therapy, health, and wellness.